Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Indications of nephrectomy in pelvi-ureteric junction obstruction. In pelvi-ureteric junction obstruction, nephrectomy, that is removal of kidney, is done if there is permanent severe loss of renal function. If there is permanent severe loss of renal function, that is if the renal function is less than 10%, then obviously we should do a complete severe loss of renal function. Then if the patient has unmanageable complications, that is very difficult complications are present for a kidney, like if the patient has severe recalcitrant infections, or if there is intractable pain in the kidney, or if there is severe hypertension. So in these conditions we should do an nephrectomy is done in pelvi-ureteric junction obstruction.
Thank you and thank you for watching.